Hello. So I'm here to talk to you today about the safety levels of working with microbes in the lab. In addition to our what we call the usual safety protocols for working in your environment, working with equipment, and all that other kinds of safety, we also have to address the our safety in terms of the microbes that are going to be using. Laboratory practices, these are the important things that we need to follow. And, your grade and your attendance, your ability to stay in the lab really are all dependent upon these things. If you violate these things repeatedly, you could be banned from the lab and getting zeros and that sort of thing. So it's that important that you follow these rules. Wash hands when you enter and exit the laboratory. And this not just the laboratory itself, but the zones where we are using active microbes and active organisms. Um, Tie back long hair, no dangling jewelry. All right. In fact, it's probably best to not really be wearing any jewelry, maybe earrings, but on your hands, especially hands, wrists, and things, it's probably best not to wear them at all because you just never know. You disinfect the bench before and after you're done working on it. So before you set up to do work, you disinfect the bench, and then when you're done and you put everything away, you clean everything, you clean the bench again before you're done. And make sure we're using them according to their instructions. Absolutely none. Food, drink, gums, anything like that. Water bottles, even water, none of it. You can leave it outside the room, outside the door. Um, and when you need a drink, or if you need a drink during lab, you'll just have to, de-gown and de-glove and all that, and go out in the hall and wash your hands and go out in the hall and get it and take your drink and then come back in and start, re-gown. Um, Try your best not to touch your face. Nothing like cosmetics, putting in contact lenses, refrain from biting your nails, things like that. Um, no personal items, cosmetics, cell phones, calculators, pens, pencils, etc. in the laboratory. We supply you with the things that you're going to need as far as that goes. Um, as far as the cell phones go, when we were using them in the lab, okay, we would put them in a Ziploc bag to make sure that if any spillage or anything while you're wearing your gloves, you could still, use it through a Ziploc bag. So if you absolutely feel like you have to have your cell phone all the time or even be using it during times where you probably otherwise shouldn't, um, you can put it in a Ziploc bag. So you might want to bring a few of those along as well. Do not mouth pipette. Something. It's an old school thing. Even older school than I am. So anyway, but I imagine there's still people around that think about doing it. So again, don't ever do that. Uh, Label containers clearly. So anything you have and cultures, not just containers, cultures as well. In fact, I'm going to change that. Keep door closed while the laboratory is in session. Um, for various reasons, things getting in or out of the laboratory, much easier to monitor who might be coming or going or who might be coming in, things like that. We have to keep track of that as we're going through the lab. Yes. Lab director instructor approves all personnel entering the laboratory. Really shouldn't be anybody in there except you who are registered students. Okay. Maybe another instructor for some reason to set up their own lab or to clean up after themselves from another lab, but otherwise, not going on. Sharps, definitely minimize the use of sharps. Can't really think of anything that we use sharps for exactly, but use those appropriately. um, Transport vessels. Use proper transport vessels. Test tube racks for moving cultures in laboratory. Store vessels containing cultures in leak-proof container when work with them is complete. Again, if you're moving something or taking something from one part of the lab to the other, have some kind of a carrier or vessel to move it in. This way, if it's dropped, it doesn't, it's a lot less likely to be dropped. But if it's dropped, it stays within the vessel and can be contained. Um, not absolutely on that, but by and large, it's a lot easier to contain. Doesn't go spreading everywhere. Um, Use leak-proof containers for storage, transport of infectious materials. Arrange for proper decontamination and disposal of contaminated material. That's up to me, which I will provide you with specific places to throw away contaminated material. These are things that have touched the culture in any way. And you need to make sure that you throw those away right according to what I'm going to be telling you each time. Don't handle broken glass with fingers. Use a dustpan and broom, which we have in the lab. Tell me about any spills or injuries. Document them. That's kind of up to me too. Keep note-taking and discussion practices separate from work with hazardous or infectious materials. For this, I always tell the students to keep a bound notebook. All right, like a composition book. That's fine. In some ways, it might be better if it had a grid on it, but just a composition notebook. That's all you need. One of those $1 things you can get for $1. And keep that there in the laboratory. You can take notes. You can write on that in the space where you're also using microorganisms, but it has to stay in that space. Okay. So anything you might need out of that, you're going to either have to copy it or something else, but it has to stay in that space. And you are going to need to be writing things down, so you'll need something like that. Okay. Use institution provided. So anything that you're going to take home, you're going to read, you're going to write on and turn in, all of that stuff doesn't get used in that zone. It gets used in the other zone of the lab that isn't going to be where we're going to restrict or ban the bringing in of any of the cultures in that space. And you'll see when we get set up in there. Like I said, we will provide you writing instruments, pens, pencils, that sort of thing. Make sure you always wear these PPEs. There's just no getting around it. Anytime you're in the zone where you are using cultures, actively growing cultures, any kind of actively growing cultures, right? Advise immunocompromised students, including those who may be pregnant or become pregnant. Students living and caring with immune compromised individual consult physicians and determine the appropriate level of participation in the laboratory. Again, be extra careful and understand your own health level to a certain degree too, and how that applies to what you'll be doing. Use micro incinerators or disposable loops rather than Bunsen burners. Bunsen burners have a way of spreading organism, whereas micro incinerators do not. But again, this is equipment that we'll be going over when we get in the lab. All right, then that finishes it up. Make sure you read through these and the documents about laboratory practice, safety practices,